the Nairobi metropolitan area, and B, the counties of Kilifi, Kwale, and Mombasa. Number 2, the cessation of movement within the Nairobi metropolitan area shall be for an initial containment period of 21 days with effect from 7 p.m. Monday, the 6th of April, 2020. That is today. And 3, that the cessation of movement within the counties of Kilifi, Kwale, and Mombasa shall be for an initial containment period of 21 days with effect from 7 p.m. on Wednesday, the 8th of April, 2020. In the intervening period, movement in and out of the coastal strip shall be limited. 4, the Nairobi metropolitan area is designated as follows: the Nairobi City County, part of Kiambu County up to Chania River Bridge, Thika, including Rironi, Dedero, Kiambu Town, part of Machakos County up to Athi River, including Katani, part of Kajiado County, including Kitengela, Kiserian, Ongata Rongai, Ngong Town, and all areas as set out in the order. 5, the counties of Kilifi, Kwale, and Mombasa. 6, any person, passenger carrying bicycles, motorcycles, scooters, automobiles, vehicles, vessels, railway wagons, or aircraft shall not be allowed in and out of the Nairobi metropolitan area and the counties of Kilifi, Kwale, and Mombasa. 7, the movement of food supplies and other cargo will continue as normal during the declared containment period through road, rail, and air. Number 8, any cargo carrying vehicle or vessel shall be assigned a single driver and designated assistants whom in whichever case shall not exceed 3 persons. All such designated persons must be notified in writing by the owner or operator of the said vehicle or vessel with reference to that vehicle or vessel. So all owners and operators of vehicles will be required to notify the authorities of the driver and the said assistance. Number 9, these additional measures do not in any way vary the existing restrictions and measures, including the daily nationwide curfew from 7 p.m. to 5 a.m. in the entire territory of the Republic of Kenya.
Well, a very warm welcome to Newark right here on TV 47. Thank you so much for joining us. Indeed, it's a beautiful day. And of course, there, President Uhuru Kenyatta earlier on addressing the nation, quite some pertinent issues he has highlighted there. And as you can see also with me in tonight's discussion is Dr. Githinji Gitahi, who is the Group CEO of Amref Health Africa. Thank you so much, Dr. Githinji. How are you feeling today? All right. Okay, and we also have Dr. Samrat Shah, who is a consultant physician. Dr. Samrat, can you hear me?
Yes, I can hear you.
Okay. Well, gentlemen, listening to the presidential speech for what Uhuru Kenyatta said earlier on, of course, there was a bit of confusion there about whether we're in a lockdown, what these restrictions mean. I'll just begin with you, Dr. Githinji, if you can just make it a little bit clearer for all the people who are listening to us today. Dr. Githinji, I'm so sorry about that. We seem to be having a bit of a technical hitch there.
Can you hear me?
Now I can hear you. Now I can hear you. But you can if you can just repeat what you were saying, it's okay.
Sorry about that. So what I was saying is that there was, the president's speech had a few restrictions, and the confusion earlier was as to whether the restrictions were purely going into and out of these restricted areas, or it included movement within those areas. So people are wondering whether it also includes a lockdown, in which case people's movement were limited to their houses. But this was later clarified to mean it was purely movement into and out of these areas. Mm-hmm. And therefore it means that because these areas have a high infection rate, or not very high, but higher than relatively other areas, it was to retain the infections within an area that's controllable, and therefore make sure that as you test, you are testing within an area, isolating without and reducing the risk of transmission from that high infection area to an area that may not have infection. So that is what was clarified. So we know now it's a partial lockdown, which only limits border movement, not within the regions that were described.
Well, thank you so much for that clarity. When we also look at some of the areas that were highlighted, we're talking about Nairobi Metropolitan, we're looking at Kwale, Kilifi, and Mombasa. I think the question would be, why these particular areas? Why is it that we have more majority cases in these particular areas? Dr. Samrat, if you can answer that question.
You see, these are high-risk areas because, one, the tourist number of traveling people to these places was very high initially when the disease was in stage 1 or stage 2, we can say. And now that the disease is epidemic, we would say that a lot of number got infected in these counties because of people getting exposed to outside people in these counties mainly, because of being a tourist destination, definitely.
Well, and if we really look at this new directive, the restrictions, we're looking at increasing numbers every single day. Dr. Githinji, do you think these restrictions in these particular areas will probably help us reduce the number of cases that we are seeing emerging every single day?
I think that the measures being taken are several. There are different measures. The first is to say that even within an area that has high rates of infection, the most important thing is to ensure that you avoid new introductions of new cases into that area. You identify the ones that exist and you test them and isolate them, and you track the contacts and make sure the contacts are also tested, they're quarantined, they're tested, and if they're negative, they're taken back to the community. So there are measures basically to make sure that you reduce transmission. Now, the measures added today are to contain the infection. They are in addition to the measures to reduce transmission. These ones are to contain the infection, so that you say there are many people, we have about 140 something cases, and you're saying majority of them are in one area, then you want them to stay there so that then it's easier to control. So yes, they are going to help reduction of exporting cases, but the measures that are going to reduce transmission within the metropolitan are the ones that are already in place, which is test, trace, isolate. Those continue.
Well, you know, if I really think about it this way, looking at the residents of Nairobi Metropolitan, Kwale, Kilifi, and Mombasa, of course, for someone like me, I'd be asking, then these areas have been cited as having majority of the positive cases. Won't this, you know, announcement also create some sense of panic for some of them who wanted to go back to the village, as what we have seen? Dr. Simra, what do you think about this?
Yeah, definitely it's going to create some amount of panics. And there are two ways of thoughts in this now. You see, some people are more concerned that those people who are residing in these areas, they want to go back to their towns wherein the chances of infections are very less. The second school of thought is people are also scared that you're not going to spread this disease from Nairobi to outside area, but what about within the Nairobi? What about the infection that spreads within Nairobi? That is also to be considered there. So there are two schools of thoughts and two modes of panic that is coming out between the people. One, they are not able to go back to the places where their chances of infection are less. Two is that what about people staying within Nairobi? Nairobi is not in lockdown. Nairobi is in containment. So what should we go for lockdown at least in Nairobi? That's the question people are asking.
And I think I'll shoot that question much later. But first, I'd also like to hear from you, Dr. Githinji. How then do we calm the fears of those who have been restricted to these areas that have been mentioned as having the majority of positive cases?
Well, I think the issue we must remember is that even if you go for a lockdown, you limit movement from the city and, you know, out of the city and into the city, either way. So, but now what we are having now, the containment and the patio, is to say you're limiting movement into and out of, but your movement within the city is not limited. So basically, it's in between a rock and a hard place. You have to make a decision, and I think the decision the government is trying to make, and they're walking very tightrope, is to say, at what point do we stop people's economic activity? You know we want to limit spread of the disease, we want to limit the infection rate, but we are also cognizant that we don't create social harm. So the government is walking a tightrope to say, let us limit. Number one is, remember that, and I could see that in the president reading, majority of our old people are actually out of country. That's where they are. Majority of the people who are economically active in these active areas like Nairobi are younger people. Now, when you open borders for urban-rural migration, you're increasing the risk of the people who are above 60 years, who are retired and they're in the rural areas. So you're increasing the risk of getting moderate and severe disease. So this is a step forward in the measures for controlling transmission and reducing risk of severe and moderate disease. And I think it's a step in the right direction. As to whether the people in those areas will feel kind of targeted, it is where the infections are. It is where now you need to limit so that you don't send the infections to the people who are outside and who have a lower risk of transmission. So it's I would say it's a rock and a hard place. That's what I would say.
All right. Well, Dr. Samrat has mentioned there's something very pertinent about a lockdown and what people feel about it. I want us to listen to InfoTrack on what exactly they had to say about one of the polls that they did recently on COVID-19. Let's just listen into what the lady had to say earlier on.
The first finding that we found in terms of the key issues that Kenyans want addressed as a matter of priority is that the coronavirus is topmost at 55%, but running very close to what concerns Kenyans as well is food at 47%. So essentially what Kenyans are telling government is, yes, we want you to deal with the coronavirus and we want you to help us fight it in the best and most effective way possible. But please don't forget to ensure that we have food security. 30% of Kenyans who believe that everyone who contracts the coronavirus dies. Another 26% of people, of Kenyans, think that young people and children cannot get the virus. The majority of Kenyans indeed are of the opinion that government should go ahead and enforce a complete lockdown. 68% of Kenyans across the country basically think that we should go into a complete lockdown. Having said that, 35% of those same Kenyans are not at all prepared for a complete lockdown. And over and above that, we have a quarter of Kenyans who believe that there is a cure for coronavirus. So as Ministry of Health, in conjunction with other partners, continues to do the exemplary job of communicating to the public, I think it is imperative for them to understand these additional knowledge gaps that are still existing, whilst they are already, communicating and educating us about the virus.
Well, there, Angela Mbitho just talking about the fact that 68%, according to the recent poll, 68% they are saying they support enforcement of a complete lockdown by government. And within that same population, 38% feel they are not ready for a lockdown. What are your thoughts about a lockdown, Dr. Githinji?
Well, let's understand that I know it's been floated, this country did this, China did this. Remember that a lockdown is not an end in itself. This is what Kenyans need to understand, that a lockdown is not a solution to the spread. It is a way of saying we are buying time. A lockdown does not send the virus away. It doesn't kill the virus. It kind of reduces the rate of transmission so that you're buying time to build your health system, to build the testing capacity, to build isolation capacity. A lockdown does not resolve the problem. So therefore, you must always remember that when you're doing a lockdown, it is not the end game. And I think Kenyans need to be explained to this, because I think the reason Kenyans are saying we want a lockdown is because they have had a lockdown worked in China, it worked here, it worked there. It did not work on its own. Now, even in countries that did a lockdown, there are several questions to ask. Number one, when is the right time to do a lockdown? Do you do a lockdown when you have your first case? And then when do you stop the lockdown? When do you call off the lockdown? Is it when your transmission rate is X? What is that number that says now we can open the lockdown? And when you open the lockdown, again, what's the question around how do you protect the people who are not infected from now being infected? Or are you going to do a lockdown until you have zero infections in the country? And then how do you avoid from future introductions from other countries? So the lockdown is not a solution to this whole problem. It is a way of saying we are buying time to prepare the health system. So for me, I would say that the best solutions to this is really not a lockdown or no lockdown. It's about putting public health measures that include social distancing, ensuring, because people can live with social distancing, making sure that people are washing their hands consistently. That's a habit you need, whether there's a lockdown or not, whether it's COVID-19 or not. Social distancing can also be a way of life in a big way, and also ensuring you have cough hygiene and wearing masks to avoid shedding of the virus. I think the decision made by the government to ask people in public transport, public places, to wear a mask is a really crucial decision, because the virus doesn't come from anywhere. It comes from people's lungs, mouth, nose. And therefore, if I have the virus, the way of stopping spread is by stopping me from shedding it out of myself onto a surface that somebody can then touch. So if we could actually implement those things, you might find that we may delay a lockdown, because again, you rush to a lockdown, then what do you do with social harm? You need to feed people, you need to pay their rent, how do you do those things? So it's not as easy as saying we want a lockdown.
It's not as simple as what Kenyans think. Well, I'm seeing Dr. Samrat quite very much agreeing with you. Dr. Samrat, what are your thoughts?
No, I totally agree with this, because you see, lockdown means we are just running behind lockdown. Then the question would be, what are you going to do on 22nd day? Yeah. You're talking about 21 days of lockdown. What on 22nd? Do you think the virus is going to go? No, that's not going to happen. What will you do on 22nd day when someone with COVID-19 comes and coughs outside? So I think, if Raz rightly said, if the basic measures are being put in place, I don't think so there is need for lockdown as of now. What is more important right now is to have more diagnostic capacity, to introduce as soon as possible the rapid diagnostic tests, to have a public-private partnership so that we have a number of people testing this COVID-19 and find out all those people and isolate. That's the most important thing which is required right now rather than lockdown. And I don't think so our economy can afford for a lockdown right now. How long are you going to go for a lockdown? That's also a question to be answered.
Wow. Very good sentiments there. Let's just moving on a bit here. According to the same poll that was done by InfoTrack, 48% actually think that COVID-19 is just like a common cold. And I think people don't quite yet understand the difference between COVID-19 and a normal cold. If we can just get your views, Dr. Simba, let me just begin with you, because I know you've also been dealing with some of these patients, some of the things you've witnessed. What would you say is a striking difference between a common cold and COVID-19?
Yeah, you see, based on WHO and CDC guidelines, what is the most important difference between the common cold and when we talk about COVID-19 is presence of fever. Fever is present in around 84 to 86% of people in COVID-19. Common cold usually may not have fever, yeah? Apart from fever, what is most important thing to have is a dry cough. You have a breathing difficulty. These are the most important symptoms right now we should consider for a common cold, for a COVID-19. When we talk about common cold, we should think about running nose, myalgia, having burning sensation in the eyes. And these are the more common features when we talk about common cold. And question of, some people ask me, do you need history of contact with person who has traveled? Right now, when I say that this disease is an epidemic, we do not need a history of contact as such right now, because this disease is an epidemic now. It's in the country. So people should forget about having a contact history. Anybody who is having fever, anybody who is having cough or breathing difficulty should immediately rush to the hospital and get tested for COVID-19. That's very much important.
And you know, when we look at this misconceptions about COVID-19 and a common cold, and of course COVID-19 on its own, there's a lot of misconceptions. Some people also thinking perhaps Africans are immune to COVID-19. Others think that young people, they cannot get COVID-19. I mean, some of these misconceptions, do you think they're the cause for a rise in COVID-19, especially, let's say, in Kenya's case? Dr. Githinji.
Well, I think there were a lot of misconceptions, obviously. You know, at some point we thought there was a temperature barrier. We thought that there's an age barrier. We thought there was a genetic barrier. But we have seen that all these things were just probably demographic travel density issues, that therefore the virus had not spread. Remember that this virus is new, and therefore it needed time to move from where it was to new geographies, and that's why it's taken time. And because there is less travel density in Africa, we think that's why it took long to get here. But we've seen, you know, right now the rising of cases in Africa, you know, is the same as everywhere else. We don't think there's any difference. But I think the point you've raised about almost 50% of people thinking this is just a common cold can be related to the initial communication. When we start talking to people about COVID-19, we say it's just another kind of a flu kind of thing. The thing we must tell people is that it's a pneumonia. It is actually a form of pneumonia, because people understand pneumonia is more severe. When you tell people it's like a cold, they think a cold is, well, I get colds all the time. But people know that pneumonia can kill. So when people understand that this is a pneumonia caused by a virus, and in some people it will be mild, in other people it will be severe, and it will require them to go to hospital, some will require to go to ICU, then people start taking it more seriously. So I think all this, the communication challenge, because it's a new virus, we are learning as we go, and also these misconceptions are the ones that have created some level of cynicism within the populations that we have to overcome.
All right. Gentlemen, I just want us to take a short break. When we return, I think I'd like us to also look at what we can do to create more awareness, whether it's the government side or the Kenyan side, common citizen, what do we do? So we'll just take a short break right now. New Week will be back shortly in a moment.
Gesturing. It is on the same point of affirming. But in this case, on gesturing, this is where as a teacher, you are working.
The second reason why entrepreneurship is important is also that it helps you to plan for business finance. Business finance here simply means how much money do you need at the point of starting the business, and when is it needed, And is it for a short period of time or for a long period of time?
We still feel that the tourists are not getting value for their money. That experiential experience they are looking for is not there.
My name is Sujata Kotam Raju. I am the National General Secretary of Hindu Council of Kenya. Namaskar to my dear sisters and brothers. Now this is the time everyone will have to take the responsibility to fight against this virus, not to spread further in this country. If at all, if you want to go out, maintain the social distance. Avoid going to the enclosed areas like supermarket, temples, churches, any religious functions. Avoid shaking your hands and hugs, any form of physical contact. You can just say Namaste. For more information, dial 719 or *719#. Kamesha Corona.
For more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
Welcome back. If you just joined us, you're watching me right here on TV47. And indeed, tonight's discussion, just trying to demystify everything about coronavirus, of course, understanding what the president said earlier on. And with me, of course, is Dr. Githinji Gitahi, who is the Group CEO of Amref Health Africa. And also we have there Dr. Sumrat Shah, who is a consultant physician. Gentlemen, before we took a short break, we were talking about demystifying COVID-19. Of course, you mentioned the issue of creating awareness, because some also feel, COVID-19 is just like a common cold. So how do we begin creating that awareness, especially within the local communities, like also, of course, like outside the Nairobi metropolitan? Of course, we're also talking about slums where maybe people do not have access to television to know what's going on. Where do we begin? Because we need to create that awareness so that people can make informed decisions and informed steps. I'll begin with you, Dr. Githinji.
Yeah, people take information from people they trust, and they take information from people they believe in. If you remember, all of us when we were in school, anything your teacher said when you're young, or, you took it for gospel truth. So those are people we call key opinion leaders. Now, we need to identify community-driven key opinion leaders who are the people who talk to the communities. We must move away from top-down communication, government to the people to people communication, where the people own the message themselves. And I would give you a few examples. Number one is that communities for a long time have had what we call community health workers. These are people who communities identify because they have leadership quality. They are probably, on average, more literate than the rest of the community, and they identify them and forward them to be trained as community health workers who then live in their communities. They don't move out of those communities, but they are constantly relied on health information. Now, this would be the first group of people to give this message. There are almost 100,000 in a country like Kenya. Giving them this information means that you create pockets of opinion leaders in the village who actually give people the right information. So that's a major area of investment. Secondly, is to find other key opinion leaders, teachers, the faith leaders themselves, elders, and talk to them so that this information can become owned by the community. If we continue to give the information from the top to the bottom, we are not going to get very, very far because people have a mistrust of hierarchy. People must own the message themselves through the structures I've talked about and others.
Fantastic. And before we even continue, I just want us to listen into what President Uhuru Kenyatta had to say earlier on, especially about wearing masks. You know, as we even talk about creating awareness, there's the whole issue about masks. You've noticed some of them are wearing masks that are made of African fabric. I mean, you question how safe are those masks. But before we go too far, let's just listen in on what President Uhuru Kenyatta had to say earlier on.
As of this morning, we have tested a total of about 4,277 persons. And today, we have an additional 16 persons turning positive, making our national total 158. In the same breath, we also note with gratitude that we have 4 persons that have fully recovered from this disease. We also, as a nation, pray for the quick recovery of those undergoing treatment as we condole with the families and friends of the 6 that have regrettably lost their lives to this pandemic. So, fellow Kenyans, having received advice from our medical professionals and experts, today we do say that Kenyans should wear masks while in public places.
Of course, very, very pertinent things that the President was touching on earlier on. Like I mentioned, walking in the streets, even just there in my own neighborhood, seeing people wearing masks that are made of African fabric. Others are just basically, some clothing. Dr. Githinji, do you think this is proper? Do you think this is safe for Kenyans?
The issue of masks has been quite controversial, and I think you have to first understand why masks. What are we trying to do? Number one is that we said, as I said earlier, that the most important thing is to stop shedding of the virus. You can stop people from coming in with the virus, and that's why we're closing borders. Some countries may have closed the borders a little too late when people had already brought the virus in, but either way, the virus will still come into the population. Even post-COVID-19, remember that the virus will still be circulating in the population. So there will still be risk everywhere. So if you have now the cases in, as Dr. Samrat talked about, now you have local transmission. The next thing is to say, test the people, identify who is positive, isolate them, so that you stop the continuous shedding of the virus. Now, one of the ways of stopping shedding of a virus is to make sure that anyone who may be coughing or sneezing and may have the virus wears something that stops droplets when you cough or sneeze, stops the droplets from leaving you and going to settle on a surface like a table, a bar in a bus, a bottle that somebody may hold, or a door handle. So this is one role the masks play. In this role, it is likely that if you test surgical masks, and you test homemade masks from some research I've seen, of course the surgical masks are superior. The homemade masks may have probably there's about maybe 50-60% of the same efficacy of the surgical mask. So are they bad? We would say that in the absence of a surgical mask, they work. But the first priority would be to get people with a surgical mask, because it is the one that has the high chance of stopping the aerosols or the droplets from leaving. Or even if you're wearing and somebody with an infection is actually coughing near you, these surgical masks are more likely to trap the droplets from entering your nose or mouth, which homemade masks, if they are not properly done, may not. So the question would be, if we can get everyone a surgical mask that's quality, then that is the gold standard. If you can't and somebody needs to use something in the absence of a mask, then the second priority would be the homemade masks. But there's obviously that risk that the infection, the transmission may still happen.
Thank you for that clarity, Dr. Githinji. Well, Dr. Samrat, when we look at now what Dr. Githinji is saying, of course, 60 to 50%, the homemade ones can work. But what's the proper material for making this mask?
You see, ideally, as rightly said, surgical masks are the right thing to be used, yeah. But apart from that, some even guidelines nowadays are telling that because of shortage of surgical masks, even if you can use a cloth, make a 3-layer of the cloth and start using it, and then wash it in a nice way with a good soap or with an ethanol-containing sanitizer, even then that's fair enough to use it because of shortage of the mask. Yeah, what is CDC also mentioning is even flexing your hands, closing your nose and mouth, and then coughing and sneezing, immediately going and washing your hands could also be enough, provided if you are taking good precautions. That's the second thing. Third thing, it also says that if you flex your hands and close your hands and with nose and mouth, even that is good enough. You can even use a tissue paper and discard the tissue paper in a closed bin. That is also fair enough to be used. That's what guidelines are telling nowadays because of shortage of masks everywhere. But as rightly said, N95 mask or a surgical mask can be good enough to use. But because they are not available, even you can go for the synthetic fibers, or you can use even 3 layers of cloth and wash it properly and reuse it. No issues at all.
All right. Well, just moving away from that, still looking at preventative measures, we've talked about the masks. There has been a trend that is growing right now, especially in Nairobi, where people are holding private parties. Of course, we saw earlier on today Nigerian actress Funke Akindele, who was fined over a Lagos party amid a lockdown. When you look at what's happening with Kenyans, you're told to observe social distancing, but people are still having parties. Do you think maybe the government should take the same measures they've taken in Nigeria, the government of Nigeria has taken towards putting in those restrictions? Dr. Githinji, what is your take about this?
Well, at the end of the day, I think this is why I talked about the need of ownership. People need to own this message, because you cannot have enough government force to supervise 50 million people. Therefore, the most important thing is that this message needs to come bottom up rather than top down, because if it's bottom up, then the people will supervise each other, they will challenge each other, they'll hold each other accountable. So police lockdowns, police implementation, I'm not a big fan of those. I'm more a fan of people empowerment and people participation. So what we need to do is change this upside down and say, this is something that puts us at risk. Who are those people in the community who are going almost like a Nyumba Kumi, if you remember the Nyumba Kumi idea, that people actually own this and watch each other, that the people who are being called by the musician to go say, no, we won't come because we know that's not good for us. But if we are constantly under this policy guideline, then our new role becomes evading government, so that we can actually do it without government seeing us. And that's not what we're trying to achieve. So I would say that the best thing would be to drive ownership of the people, so that people understand what they need to do. And I think this is what the minister and the president have been trying to talk about, but we need to implement strategies that actually drive that ownership voluntarily through free will rather than through policy enforcement. Of course, there is still a role for policy enforcement, but people empowerment and participation is more successful, as we have seen also with Ebola in other countries, that when people own it, they then work to do what is right.
Well, let's just look at also, just before we even go into my next point, Ugandans online have expressed mixed reactions towards the government's plan to reopen schools from the end of April. Dr. Githinji, what do you think about this? Being the CEO of Amref Health Africa, and of course you've seen some of these things that are happening in different African states. Do you think this is something that not just Uganda, but any other African state can consider, that they open schools again towards the end of April?
This is the big question we were discussing earlier when Dr. Samrat was asking, what do you do on day 22nd if you lock down for 21 days? Because the decision to open schools must be guided by some evidence. If you close the school, you close to avoid transmission. So if you decide to open, then you must be saying that the risk for transmission is no longer there. So that's the big question is, every government, if you have taken a step, there must be what guides you to change that step. And I don't think those have been followed, and whether there are any measurable steps that we can say that now, because the infection has ended or transmission is below a certain point, and therefore we can open schools. So I would like to first say that the most important thing is to understand whether the risk has significantly reduced or the risk is the same. And I do not think that the risk has significantly reduced yet. And therefore, you may see governments opening schools and then closing them again, because once you get an infected cohort in a school, or you find a positive case in a school, then you have to shut it down again. So we just need to be careful. I would not want to prescribe to governments, but just to be careful to say, has the risk reduced significantly for you to reopen?
All right. Well, I think even for those people who are considering going back to school, some of them still want to have parties. Perhaps people are getting impatient because they're used to getting out of their houses, having normal business, getting out there and doing what they usually like to do. Looking at the situation as it is, I know Dr. Githinji, you had mentioned from an earlier post, I think last week, that it might take 5 to 6 months before we see a change from the current situation. I think the question now would be, with the impatience we're seeing with very many people across the globe, not just in Uganda, even in Kenya, is there a possibility of us getting a vaccine for COVID-19 anytime soon? Dr. Samrat.
Vaccine, as of now, there are some vaccines which are in trial. I would say they are in phase 3 trials, but you see, to get an approval from US FDA or to get approval from WHO, it's going to take minimum 1 year from now. So I don't think so we are expecting any vaccine before July 2021. So I think people should learn how to have patience at this point of time, because it is a difficult time, and I don't think so we are still in lockdown. We can still just follow simple basic measures rather than sitting and waiting for the vaccine or the medication to come. I think if we follow the simple measures, things can be much better than what we are today.
Dr. Githinji, what's your take about the BCG and the hydroxychloroquine drug? Very difficult there to mention, but what do you think about it?
I think I'll ask Dr. Samra to comment because he's the front line. But I'll
have him comment on the same.
Exactly. I've seen studies that talk about the protective value of BCG and comparatives about countries that don't have BCG, countries that have BCG. I would say that these are studies that are continuing. They're obviously being debated by different scientists, and whether they hold water eventually, we will see. And maybe Dr. Samrat has more information on this. Yeah. But I have seen some kind of people saying that, the BCG vaccine may protect against other respiratory conditions. Probably people who had BCG are less likely to have had exposure to the tuberculosis bacilli or bacteria, and therefore their lung integrity is still intact or higher. And people who never had BCG may have had latent TB, and therefore their lungs are already compromised a little. So I will let him comment about that. On the issue of hydroxychloroquine, there have been many trials showing that there's a high level of efficacy, or it is able to reduce the level of disease, of the severity of disease. We have seen people say up to 50% improvement. And this, I've seen some countries like Senegal, it's from the protocol. But in my discussions with Africa CDC today, because I sit on their board, the Africa CDC has released a memo to countries saying they do not recommend wide use of these treatments unless they're in a trial status, like you're probably doing a research and you have a couple of, a number of patients you're trying on under a research condition, but not for widespread use. I have not seen that recommendation yet. And I'll be more than happy to hear what Dr. Samrat has to say.
And let's hear from him. Dr. Samrat.
Yeah, you see about BCG, I would like to say that I'm not much in favor of BCG vaccine favoring the control of the disease or so, because you see BCG vaccine is given in developing countries like, let's talk about India. Every child is given BCG vaccine, even we were given BCG vaccine when we were a child in India. But now today we are seeing more than 4,000 cases in India also. And I don't think so that BCG vaccine, these are all hypotheses which have been placed. I have even read an hypothesis saying that ivermectin is protective against COVID-19. You see, they are all predictions which are coming out. We don't have any confirmatory studies for this. So as of now, we should not believe all these things, because what is happening is the more we believe these things, the more is negativity coming in our mind that because I have taken BCG vaccine, I may be safe, and we start taking less precautions than what is required. So I think that should not be happening. So I think let's forget about the facts about these things, because they are nothing proven still yet. That's the first thing I want to comment about BCG. Second thing about hydroxychloroquine, my point is we are seeing hydroxychloroquine being used in India as well. But we know that COVID-19, 80% of patients, they have milder symptoms. Only less than 10% people, they go for severe kind of symptoms. We don't have studies which clearly state a difference between whether hydroxychloroquine was useful in these 80% of cases, or we are talking about those patients who were on ventilator, who came out of ventilator. There are no proven studies. If we are talking about those 80% of people, how do you assure that it is hydroxychloroquine which is helping you to get better? Because those patients are anyhow going to get better, whether you take HCQS or you don't take HCQS. They are anyhow going to get better. That's the first thing. Second thing, because of increased awareness being created about HCQS, those people who actually need HCQS, let's say like people with rheumatoid arthritis, people with systemic sclerosis, all those autoimmune disorders patients, they are not getting those drugs which are going to be life-saving for them. So we have even seen deaths happening because of HCQS toxicity, because it causes QT prolongation and which causes the hearts to stop. So I think right now we should not believe in HCQS theories or BCG theory unless and until it is being approved by a US FDA body or it is being approved by WHO body.
All right. Thank you so much, Dr. Samrat, for those comments. I want us to take another short break, and when we return, of course, we just go deeper into tonight's topic, and of course, a few questions from some of the viewers who are watching us live. So don't go too far. New Week will be back shortly.
Peterson, tumefutwa wote.
Yawa, pia wewe.
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako.
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deed spare. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikuambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
Want to grow your business? You can simply do so on our 24-hour nationwide TV station. Email us on ads@tv47.co.ke. Or simply call us on 0748 205 604.
0748 205 604.
Talk to us today, because the growth of your business is our business, right here on TV47.
Mengi yamesemwa kuhusu jinsi virusi hivi vya korona vinavyosambaa na kuzuiliwa. Hata hivyo, sio yote unayasikia ni ukweli. Uongo mwafanya watu wengi kuishi kwa woga kote ulimwenguni. Nimekutana na watoto wengi wakisema kuwa mbu, yani mosquito, husaidia kusambaza virusi hivi. Huo si ukweli. COVID-19 husambazwa na hewa. Na hiyo hufanyika wakati mtu aliyepata virusi hivi hukohoa na chembe-chembe za mate usafiri hadi kwa mtu mwingine. Ni aina fulani ya mbu ndio huleta ugonjwa wa malaria. Ni ukweli kwamba ukipata chanjo ya pneumonia itakuzuia kupata virusi hivi? La hasha. Hivi virusi ni vipya. Wataalamu na madaktari wanajizatiti vilivyo kuvumbua chanjo mpya ili kukabiliana na virusi hivi. Njia ambayo ni mwafaka na rahisi kupunguza kuenea kwa ugonjwa huu wa corona au COVID-19 ni kunawa mikono yako kwa kutumia sabuni na kujiepusha na vikundi au umati. Kumbuka kuwa mimi na wewe tunaweza kufanya mabadiliko makubwa.
When we first heard that Kenya had actually announced the first case of coronavirus, I'm sure majority of us panicked and we were all asking ourselves, what are we going to do? And finally, this thing is here with us. I'm sure even today, as these numbers continue to increase, we are worried as a nation. But the message of hope that I have for all of us is that this is just one of those moments that we will be looking back in some time in our history, and we'll be able to look back and celebrate how we managed to actually deal with this situation. To those who are actually in employment, I'm sure and I feel your concern about, whether your job is still safe, whether you still have that particular job. I've heard and I've read of several media houses, several companies that have even had to take pay cuts. I think this is that particular moment when we need to actually be open-minded, ready for anything as long as it is going to help sustain and keep all of us, going on. Now, for those who are in various businesses trying to keep up with what they've been doing and keeping up the Kenyan spirit, the good news is that here at TV47 we also celebrate and feel you, and that is why we've given out an opportunity even for free advertising so that you're able to still keep the name of your brand and also tell your people what you're doing to actually roll back the cases of coronavirus. I know you've been told to stay home. I know you've been told to keep social distancing. Some of us have really felt that this is not practical, but this is that time when we need to take bold steps and try a little harder to actually follow to the latter what we're being told by the authorities in order to roll back and flatten this particular curve of coronavirus cases. Stay safe, stay home.
Welcome back. If you just joined us, you're watching New Week right here on TV47. Tonight's discussion, of course, COVID-19, and it's been a very insightful discussion here with my panel. Here we have Dr. Githinji Gitai, who is the Group CEO of Amref Health Africa. Of course, also we have Dr. Samrat Shah, who is a consultant physician. Gentlemen, before we go too far, I want us to just sample some of the comments from our viewers who are watching across the country and globally as well. So here we have Engineer John Macharia saying, awesome stuff here, watching live from Eldama Ravine Baringo. We also have Meshek Wambua, who is asking a question, by the way. He's saying, has there been a model to forecast the death rates arising from COVID-19? And if yes, which parameters have they used? Let me just repeat that question, Dr. Githinji. Has there been a model to forecast the death rates arising from COVID-19? And if yes, which parameters have been used? Dr. Githinji, I'll begin with you.
If I understand the question is simply asking whether there has been a country which has managed to manage this particular epidemic and made sure that the death rate is low. That's basically what I'm hearing from the question. And what approaches have they used? There has been quite a bit of conversation around Germany, for example, having over 100,000 cases and keeping their death rate very low, less than 2%. And the question has been, what have they done? I think if you were to say, we are now not answering the question of transmission. We are saying the transmission is going on, but the death rate or severity is low. That's what the question is asking. So the only way to do that is making sure that you have, number one, you catch your cases early, that you test early, you test widely, so that you know who is sick early, and therefore the people who are you are able to identify as positive early and observe them early, you're therefore able to catch them when their symptoms are still low, if they are going to develop symptoms. If you get them when they're already in severe distress, then it's likely that you'll have a higher death rate. That's the first thing. The second thing is the capacity of the hospitals. That if you have a system, or the capacity of the health system, if you have a health system where people fear to come and seek care because they need to pay out of pocket, in which case the people do not have universal health coverage, and therefore they have to worry about paying out of pocket, it is likely they'll delay, they'll come late, and when they come late, they'll also avoid going to hospital because they'll be charged to pay. So these are, this kind of presents the access issue, that people must be able to access care when they need it. And finally, when the people access the care when they need it, do you have the capacity to take care of them? If you look at Germany, of a population of about maybe 87 or 90 million people, they have close to 40,000 intensive care beds. They have actually 37 or 40 intensive care beds for every 1,000 people, whereas in many other countries we are talking about 1 bed for 1,000 people. Even in Italy we are talking about 7 beds for 1,000 people. So Italy has almost about 5 times more intensive care beds than Italy. So Germany has about 5 times more than Italy. So there is also now that question about the capacity of the health system to take care of the people who need it when they need it. So I would say if you follow those steps, then you'll have a low mortality. Even if you have infections going up, you have less and less people dying away.
Okay. Also, Humphrey here, Magori and Bruce, says that what the president said is not the problem. Rather, he's referring to the presidential speech earlier on. He says the problem is not what the president said, but what the police understood. Well, the other comment here from Sumar Manjothi, he says, can a local mask help? I think Dr. Githinji answered that earlier on. 50 to 60% can work, but it's good to get the proper surgical ones. Well, we also have here Liz Nelly saying, watching live from Saudi. Of course, also Meshach Ewoy saying he's watching from Turkana. And many of you, of course, are also watching at this moment. We'll mention your comments as we move on. But, gentlemen, I want us to move into something that came out yesterday, even in local media. It's a concern. Kenyans who are in government-designated mandatory quarantine sites have described how they're coping with life in isolation. Some of them feel there's a very high risk of them contracting the COVID-19 virus. Dr. Shah, you've been on the ground. Probably you've been able to witness some of these things. I'm not sure if you've seen what they're talking about, but what can you say about that, Dr. Samrat?
I didn't get the question. Can you come again?
The question here is about the government-designated mandatory quarantine sites. Some of the people who have been put on in those quarantine sites, they feel that they have been at risk because they are sharing washrooms, they are sharing also bathrooms. What would you say about that, Dr. Samra? Because you've probably been in contact with some of these events.
Yeah, you see, that's very true. We have seen a lot of people who have put in quarantine, and especially the biggest trouble what people are facing is not just sharing of these things, but also I have seen people telling that they have been quarantined for more than 14 days, and which is more putting them at risk. And as rightly said, they have been sharing toilets. They are coming in contact with people who are there, and some of them have been tested positive as well. You know, some people who came with a flight from Canada, they were together isolated. They were kept in quarantine together. One was found negative, but the other was found positive. But there was no proper isolation facility being done, and that's very truly being seen because these things are seen mainly because of lack of isolation facilities. We don't have a typical isolation wards. We don't have a good isolation facility what requires a negative pressure or say positive pressure or a standard isolation wards, and that might be the reason why people are fearing for it. But I would say if you are into self-quarantine or isolation, make sure that you avoid coming in contact as much as possible. That's the best way to can go ahead with it.
All right. Well, even as we come
sorry.
Yes, Dr. Githinji, go ahead.
Yeah, because Dr. Salman has made an important point that when you are in isolation or in quarantine, does not mean that all the other measures of protecting yourself are therefore not important. So even if you're in quarantine, it means you must also continuously wash your hands. It means that you must also observe social distance, even when you're in quarantine. It means that if you're going to meet a group of people, you must wear a mask. And let me say maybe a quick comment on that mask. And Dr. Samra did add, because I don't want to leave the impression that the cloth masks are bad and should not be used. They should, and he made a point about the 3-layer, that it need to be 3-layer. All we are saying is that their protection may not be 100% like the surgical mask, but it's better a cloth homemade mask than none at all. So please remember that. But even in quarantine, always observe the same measures that people are advised to use when they're outside quarantine.
Well, Dr. Githinji, as we come to a close, I think we'd like to know, so what next now? Of course, we've heard from the president today. What should we expect in the coming days? I know you mentioned sometime last week that this situation we're in may persist for about 5 to 6 months. So what are we looking now? What can you tell Kenyans?
Well, I think it's, the thing that I've said is that we need to be patient. What's going on here is that you cannot really control the spread of a disease in a very short time. So it's going to be several weeks of working together with the government, with the people. And the measures that are being done are dependent on, are the cases going down, are they going up? We know that Kenya is getting rises. Every day we hear 16 more, 12 more. So we are worried about the transmission because also we know that this virus is highly infectious. The studies we have seen that one person can infect up to almost 3 people. So therefore, after you infect 3 people, those 3 people can infect 3 people, and like that. The ratio is about 2.6, but I'm using a whole number just for ease of explanation. So it means that when you have a few of these infections, it is likely to go exponential. So therefore, the measures need to take time. You need to find all the people who are infected, test them, quarantine them, test them, and some of these measures we see the government taking, saying 21 days. It doesn't mean that now on the 22nd day we are all fine, all borders are open. It just means that 21 days is a waiting game to see what happens, and then we decide, do we extend by 21 days? Do we actually increase the measures more beyond now containment to total lockdown? So it's a wait and see situation. And in a wait and see situation, because the virus does not read books, does not listen to speeches, does not read guidelines, it means that it could behave the way we don't expect it to behave. And therefore, our mindset should be the mindset of, let me wait and be ready to wait for a long time. If we end up managing this earlier, then we don't celebrate. But if we think a short mindset, then we have mental health problems because people's expectations have not been met. People are putting themselves under extreme pressure on their businesses, on their cash flows. So that's why I'm saying, let people prepare as if this will be a 4 to 5 month period. If we manage to do it earlier, we celebrate. But let's prepare for a long to medium term.
All right. Thank you so much, gentlemen, for your comments and being part of this discussion tonight. Dr. Githinji Gitahi, Group CEO, Amref Health Africa, thank you for your time. Of course, also Dr. Samrat Shah, a consultant physician, thank you for your comments and your time tonight. Of course, this has been New Week. Thank you for all the comments and feedback from you also who have been watching tonight. Again, join me next week, same time, same place for New Week on Monday at 9 p.m. My name is Leangare. Our sign language interpreter tonight has been Josephine Oko. Thank you for watching. Until Monday next week, good night and God bless.